Okay, well this is an EndoBarrier. It's a device which is placed during a simple endoscopy procedure into the first part of the small intestine. It's held in place by these little hooks here, and then food passes through it rather than the small intestine. So the first time the food comes into contact with the small intestine is 60 centimetres further down than usual, and it's been shown that that leads to a lot of weight loss, and in terms of diabetes, improvement in glycemic control. It mimics the bypass bit of the Roux-en-Y bariatric procedure, which and presumably works in a very similar way. We don't know entirely how it works, but I think that there's a big change in incretins and also the gut microbiome and various other things that could account for it. Well, in our service, the patients we've been treating with EndoBarrier are those who have pretty much tried all other treatments except insulin, or if they're on insulin, the insulin is maintaining the obesity at the expense of pushing down the hemoglobin A1C. So they're patients who remain poorly controlled despite all the other medications and lifestyle, and obese. And it turns out that this set of patients tend to have a long duration of diabetes. The patients that I'm showing at this meeting from our NHS service have a median duration of diabetes of 12 years. 60% of them are on insulin already. The BMI was over 40. And during the year with EndoBarrier, I forgot to say earlier that the EndoBarrier is removed after a year, so it's a chance for the patient to have a big improvement, but then they have to sort of maintain that after the EndoBarrier is removed. So with our group we've implanted 62 EndoBarriers. 38 of them have reached 6 months after removal of the EndoBarrier, and 31 have attended for follow-up, and the data I'm presenting at this meeting is of those 31. And during the year with EndoBarrier, they lost about 16 kilograms. And the BMI went from 41 to 34, and the hemoglobin A1C went from a mean of 10% to 7.5%. And there was a big reduction in insulin dose in those taking insulin from 104 to 25 units, and 6 of the patients came off insulin. The ALT improved as a marker of fatty liver disease, and we've shown using MRI scanning that this is fat coming out of the liver. And the systolic blood pressure improves as well. When we realised that EndoBarrier was having this effect on our patients, we were aware that some patients with obesity have obstructive sleep apnea, which also has a high cardiovascular risk. So we were interested to see to what extent we might be able to improve their obstructive sleep apnea. So the data we presented at this meeting is of 12 patients with moderate obstructive sleep apnea according to NICE criteria, who are on continuous positive airway pressure ventilation. They had diabetes or pre-diabetes, and we've been tracking them, and we found that by 6 months after the EndoBarrier was implanted, they lost 9.9 kilograms, and 7 of the 12 patients no longer required CPAP, and by 9 months, 4 of the other 5 no longer required CPAP, i.e. their sleep studies showed that their overnight sleep studies had improved such that they were less than the criteria set by NICE for moderate sleep apnea. So obviously these are very happy patients, because not only have they had improvements in their diabetes, but they no longer require to wear CPAP overnight.